Good morning, and welcome to Health After 50. I'm your host, Dr. James Walker. Today we're talking about something that could literally save your life or the life of someone you love. If you're over 60 or you know someone who is, what I'm about to tell you might shock you. 3 simple things that millions of Americans do every single morning could be tripling their risk of having a stroke, and most people have no idea they're putting themselves in danger. I've brought in one of the country's leading stroke specialists to break this down for us. Dr. Michael Grant has been treating stroke patients for over 25 years, and he's seen patterns that most people never hear about. Dr. Grant, welcome to the show.
Thanks for having me, James. I wish more people understood what we're going to talk about today. In my practice, I see the same story over and over again. Someone has a stroke, and when we dig into their daily routine, we find these same dangerous morning habits. The tragedy is that most of these strokes could have been prevented.
Before we dive into those habits, help our listeners understand something. Why is the morning such a critical time when it comes to stroke risk?
That's a great question, and it's something most people don't realize. Your body goes through dramatic changes when you wake up. After lying down for 6 to 8 hours, your blood pressure naturally surges as you get up and start moving. Your heart rate increases, your blood becomes thicker, and stress hormones like cortisol flood your system. Think of it like a car engine that's been sitting cold all night. You wouldn't immediately floor the accelerator, right? But that's essentially what many people do to their cardiovascular system every morning. The statistics are sobering. More strokes happen between 6 and 10 in the morning than any other time of day. We call this the morning surge, and it's when your blood vessels are most vulnerable. Now, if you add certain habits on top of this natural vulnerability, you're creating a perfect storm.
So what are these habits that are putting people at such high risk?
Let me start with the most dangerous one, and this might surprise people. It's jumping into intense physical activity immediately after waking up. I've had patients who would wake up and immediately start doing vigorous exercise, running, heavy lifting, even intense yard work. One gentleman I treated, a 62-year-old retiree, had made it his routine to wake up and immediately start splitting firewood for an hour. He thought he was being healthy and productive. What he didn't understand is that his blood pressure was already spiking naturally from waking up, and then he was asking his heart to pump even harder to supply oxygen to his muscles. His blood vessels couldn't handle the sudden, intense demand. He had his stroke on a Tuesday morning, axe in hand.
That's frightening. What should people do instead?
The key is gradual transition. When you wake up, give your body time to adjust. Sit on the edge of your bed for a minute or two. Do some gentle stretching. If you want to exercise in the morning, and I encourage that, start with light movement, maybe a slow walk around the block, some gentle yoga, or basic stretching. Save the intense workout for later in the day when your cardiovascular system has had time to fully wake up. I tell my patients to think of their morning routine like warming up a car on a cold day. You don't want to rev the engine immediately. You want to let it warm up gradually.
What's the second dangerous habit you see?
Dehydration, combined with excessive caffeine intake. This is incredibly common, especially among people who pride themselves on getting an early start to their day. They wake up, skip water entirely, and immediately drink multiple cups of strong coffee. Here's what's happening in your body. After 6 to 8 hours without fluids, you're already mildly dehydrated. Your blood is thicker than it should be. Then you add caffeine, which is a powerful stimulant that raises your blood pressure and heart rate. It also acts as a diuretic, which means it makes you lose even more water through urination. So you're making your blood even thicker while demanding more from your cardiovascular system. I had a patient, a 65-year-old business owner, who would wake up at 5:30 every morning and immediately drink 4 cups of black coffee while checking emails. No water, no food, just coffee. He did this for years. His stroke happened on a morning when he was particularly stressed about a business deal. The combination of thick blood, high caffeine, elevated blood pressure, and stress was too much for his arteries to handle.
4 cups of coffee first thing in the morning? That does sound excessive. What do you recommend instead?
Start with water. I tell my patients to keep a glass of water by their bedside and drink it as soon as they wake up. Your body needs to rehydrate after the night, and this helps thin your blood naturally.
If you're a coffee drinker, and there's nothing wrong with moderate coffee consumption, limit yourself to 1 or 2 cups and don't drink them on an empty stomach. Better yet, try having your first cup of coffee after you've had some breakfast and water. The food helps slow the absorption of caffeine so you don't get that sudden spike in blood pressure and heart rate.
You mentioned breakfast. Is that connected to the third dangerous habit?
Exactly. The third habit is eating heavy, high-sodium breakfasts, especially when combined with skipping medications. I see this pattern frequently in my older male patients. They'll have a big breakfast, bacon, sausage, eggs, toast with butter, maybe some hash browns, all foods that are loaded with sodium and saturated fat. Then they'll either forget to take their blood pressure medication or deliberately skip it because they feel fine. Let me explain why this is so dangerous. High sodium foods cause your body to retain water, which increases blood volume and raises blood pressure. Saturated fats can make your blood stickier and more likely to form clots. When you combine this with a natural morning surge in blood pressure plus skipped medications, you're creating conditions that are ideal for a stroke. I remember one patient, a 58-year-old truck driver, who would stop at the same diner every morning for what he called a real breakfast. 3 eggs, bacon, sausage, hash browns, and buttered toast. He'd wash it down with coffee and skip his blood pressure pills because he said they made him feel weak. One morning, he never made it out of that diner.
That's heartbreaking. What about people who say they've been eating the same breakfast for decades without problems?
That's the dangerous thinking I hear all the time. Your cardiovascular system changes as you age, especially after 60. Arteries that could handle high sodium and saturated fat at 40 might not be able to handle the same load at 65. Your blood pressure tends to rise with age, your arteries become less flexible, and your body doesn't process sodium as efficiently. Think of it like an old pipe system in a house. When the pipes are new, they can handle high water pressure without problems. But as they age and develop buildup, that same pressure can cause them to burst. Your arteries work the same way.
So what should a healthy breakfast look like for someone over 60?
Focus on foods that support your cardiovascular system rather than stress it. Oatmeal with fresh fruit is excellent. The fiber helps lower cholesterol, and the potassium in fruit helps balance sodium. Greek yogurt with berries provides protein without excessive sodium. Whole grain toast with a small amount of natural peanut butter gives you sustained energy. The key is moderation and balance. You can still enjoy eggs, but maybe limit them to 2 or 3 times a week instead of daily. If you want bacon, have a small portion, not half a pound. And always take your medications as prescribed, preferably at the same time each morning so it becomes routine.
Let's talk about recognizing the warning signs. If someone is having a stroke, what should family members or bystanders look for?
This is crucial information that everyone should know. We use the acronym FAST: face, arms, speech, time. Let me break this down because recognizing these signs quickly can mean the difference between full recovery and permanent disability or even death. F is for face. Ask the person to smile. Does one side of their face droop? Does their smile look uneven or lopsided? Stroke often affects one side of the body, so facial drooping is a classic early sign. A is for arms. Ask them to raise both arms over their head. Can they keep both arms up, or does one arm drift downward? You can also check grip strength. Have them squeeze your hands with both of their hands. Is one grip noticeably weaker? S is for speech. Ask them to repeat a simple phrase like, "The sky is blue," or "Today is Tuesday." Is their speech slurred? Do they have trouble understanding what you're saying? Are they using the wrong words or speaking nonsense? T is for time. If you see any of these signs, time is critical. Call 911 immediately. Don't wait to see if the symptoms get better. Don't drive them to the hospital yourself. Emergency medical services can start treatment on the way to the hospital, and they can alert the stroke team so treatment begins the moment you arrive.
How much time do doctors have when someone arrives at the hospital?
We have a saying in stroke medicine: time is brain. For the most effective treatments, we ideally want to see patients within 3 hours of symptom onset, though some treatments can be effective up to 4.5 hours, and certain procedures can help even later if the patient meets specific criteria. But here's the key point: every minute matters.
Brain cells die quickly when they're deprived of oxygen-rich blood. The sooner we can restore blood flow, either by dissolving the clot with medication or removing it surgically, the better the outcome. I've seen patients who arrived within an hour of symptom onset walk out of the hospital a few days later with minimal effects. I've also seen patients who waited 6 hours arrive with permanent paralysis that could have been prevented. Don't gamble with time when it comes to stroke symptoms.
Are there other warning signs people should know about?
Absolutely. Sometimes strokes don't present with the classic fast symptoms, especially in women and older adults. Watch for sudden severe headache, the worst headache of your life, as we say. Sudden vision loss in one or both eyes, sudden dizziness or loss of balance, sudden confusion or sudden numbness anywhere in the body. I always tell families, if something seems suddenly and drastically different about your loved one, they're acting confused when they're normally sharp, they're stumbling when they usually walk steadily, they're slurring words when they normally speak clearly, trust your instincts and call for help.
Let's go back to prevention. Beyond avoiding those dangerous morning habits, what else can people do to reduce their stroke risk?
Prevention is really about managing your overall cardiovascular health, and it's never too late to start. The most important thing is controlling blood pressure. High blood pressure is the single biggest risk factor for stroke, and it's often called the silent killer because you can feel perfectly fine while your blood pressure is dangerously high. Every adult over 50 should know their blood pressure numbers and have them checked regularly. If your doctor prescribes blood pressure medication, take it consistently. Don't skip doses because you feel fine, and don't stop taking it without talking to your doctor first. Diabetes management is also crucial. High blood sugar damages blood vessels over time, making them more likely to develop clots or rupture. If you have diabetes, work closely with your healthcare team to keep your blood sugar levels stable.
What about lifestyle factors?
Diet plays a huge role. The Mediterranean diet has strong scientific evidence for reducing stroke risk. That means plenty of fruits and vegetables, whole grains, fish, olive oil, and nuts, while limiting red meat and processed foods. The goal is to keep your arteries healthy and your blood flowing smoothly. Physical activity is equally important, but remember what we discussed earlier. Ease into it gradually, especially in the morning. Regular, moderate exercise strengthens your heart, lowers blood pressure, and improves circulation. A brisk 30-minute walk most days of the week can significantly reduce your stroke risk.
What about smoking and alcohol?
Smoking is one of the worst things you can do for your stroke risk. It damages the lining of your blood vessels, makes your blood more likely to clot, and raises your blood pressure. If you smoke, quitting is the single most important thing you can do to reduce your risk. It's never too late. Even people who quit in their 60s see immediate benefits. Alcohol is more complicated. Light to moderate drinking, that's 1 drink per day for women, 2 for men, might have some cardiovascular benefits. But heavy drinking definitely increases stroke risk. It can raise blood pressure, cause irregular heart rhythms, and contribute to the formation of blood clots.
You've been treating stroke patients for 25 years. What changes have you seen in that time?
The good news is that stroke treatments have improved dramatically. We have medications that can dissolve clots, procedures that can physically remove them, and rehabilitation techniques that help people recover function they thought they'd lost forever. But I'm also seeing strokes in younger people more often, and that's concerning. We're seeing people in their 40s and 50s having strokes, often related to lifestyle factors, poor diet, lack of exercise, high stress, smoking, and yes, those dangerous morning habits we've been discussing. The other thing I've noticed is that many people still don't recognize stroke symptoms quickly enough. They wait to see if symptoms will go away on their own, or they're embarrassed to call for help if it turns out to be a false alarm. I always tell people, I'd rather see you in my emergency room with a false alarm than in my morgue because you waited too long.
That's powerful advice. What would you say to someone listening who recognizes themselves in the dangerous habits we've discussed?
Don't panic, but don't ignore it either. The fact that you're listening to this conversation shows you care about your health, and that's the most important first step. Start making changes gradually. Remember, we talked about the importance of gradual transitions. If you're currently jumping out of bed and into intense activity, try setting your alarm 15 minutes earlier and use that time for gentle stretching or slow movement.
If you're drinking 4 cups of coffee first thing in the morning, try reducing to 2 cups and adding a glass of water. If your breakfast consists mainly of processed high-sodium foods, try incorporating one healthy element. Maybe switch from white toast to whole grain or add some fruit. The key is not to try to change everything overnight. Pick one habit and work on it for a week or two until it feels natural, then tackle another one.
What about medical care? Should people see their doctor?
Absolutely. If you're over 60 and haven't had a comprehensive physical exam in the past year, schedule one. Make sure your doctor knows about your morning routine and any symptoms you might be experiencing, even minor ones like occasional dizziness, brief episodes of confusion, or mild headaches. And please, if you're taking any medications for blood pressure, diabetes, or cholesterol, don't skip doses or stop taking them without talking to your doctor first. I can't tell you how many stroke patients I've treated who had stopped taking their medications because they felt fine.
Dr. Grant, as we wrap up, what's the most important message you want our listeners to take away?
The most important thing to understand is that strokes are largely preventable, especially the types we see most commonly in people over 60. Small changes in your daily routine can have enormous impacts on your risk. You don't have to completely overhaul your life overnight, but you do have to take action. Stroke doesn't give you a warning. One day you feel fine, and the next day your life and your family's life can be completely changed. The morning habits we've discussed might seem harmless, but they're not. They're putting unnecessary stress on your cardiovascular system at the most vulnerable time of day. Start tomorrow morning. Drink a glass of water when you wake up. Take a few minutes to stretch gently before you get moving. Have a balanced breakfast and take your medications. These simple changes could save your life.
Dr. Michael Grant, thank you for sharing your expertise with us today. This has been incredibly valuable information.
Thank you for having me, James, and thank you to everyone who listened today. Remember, your health is in your hands. Make the choices that will keep you healthy and active for years to come.
To our listeners, please share this episode with anyone you care about who's over 60. The information we've discussed today could literally save their life. Knowledge is power, but only if you act on it. Take care of yourselves, and we'll see you next time.